Well, nice to meet you all this morning. I'm glad to be here, and I thank you for inviting me. But let me just tell you a couple things about myself and why cannabis has become sort of a big part of my clinical practice. And when I went to medical school, I realized that I wasn't taught enough things that I wanted to know, and so I focused a lot on my own in nutrition. Lo and behold, we know that no one in medicine really has taught a whole lot of nutrition, but it's been crucial in my understanding of helping patients. And then I came to Maine, and a couple of things happened. As I was a young physician here, I learned a lot in the first 5 years, but I also learned a lot of the limitations of what I knew. And so I began to look a little bit beyond the conventional way of treating patients. And among the many things I began to focus on, I took a deep interest in botanical medicine. I also worked at the Madison Health Center, and Madison is right next to Starks, and Starks is the home of Hempstock and all those wonderful festivals that have been going on for 30 or 40 years. And all those individuals who are kind of the grassroots educators for Maine about all the benefits of cannabis, just about all of them were my patients. And so this was before the time that we actually had cannabis laws. And curiously, because I like plants, I knew about cannabis already in my life, but I began to realize that this cohort of patients were really quite unique in that they were being very responsible to take care of a lot of their medical problems, and they were using cannabis. They were not using a whole lot of opiates, because chronic pain was the major reason they were using it, and some of them had more complicated issues where they were using opiates and cannabis, or they're using seizure medicines along with cannabis. And I began to realize that there was something about this. I then moved off to Augusta in 1995, and in 1999, the first cannabis laws were passed. And all my friends and patients from up north, followed down, and they all got their first certifications. And so it's been an interesting journey ever since then. And so I've been involved in educating physicians. I teach at the residency where I'm no longer working. I introduced that to the residents and the training of physicians. We developed an integrative medicine curriculum. And so to give you a little hope, there are physicians out there. I think my bias is that family doctors are doing it faster than anybody else. But there's a more holistic approach being taught across the board in the United States. And family doctors are probably going to lead the way a little bit more than everyone else. But the outcome, in my experience, is that when you do things holistically, everything works a little bit better, and we're less dependent on pharmaceuticals. So I'm probably talking to the choir because you're here and you want to learn some more. So we're going to talk a little bit about the clinical conditions that are most common. There's some background information, here about the states that have medical cannabis laws, et cetera. But I think we're really fortunate that we're practicing in Maine and that I've been here for as long as I have, because Maine has really led the way on the East Coast, being like the 5th or 6th state to legalize medical cannabis. And I think we've been pretty cautious, and we've been pretty thoughtful about how everything has evolved. And I could not imagine 25 or 30 years ago what the cannabis world would look like, but I'm very happy that we've moved to the place that we are now, because I think we're sort of going beyond that curve of educating everyone and still trying to convince them it's good, and that there's a lot of people out there who are much more involved. And this is to show, about the interest that's there. Early on when people came, to see me in the first 10 years, 1999 to 2009, they really came for muscle spasm and pain, and it was a grow-at-your-own type of society. And not until 2009, when chronic pain actually got listed, as an indication, that people then began to realize that there was an opportunity for a lot more people to come and seek opportunities. So in the first 10 years, I probably certified 50 people, and in the last 10 years, you can multiply that by, I've certified a few thousand people in that period of time. And I did it in the context of my practice and taking consults, from everyone. After that time, chronic pain really became one of the leading indicators. And if I was to indicate the 4 or 5 topics that you're going to see your patients talking about, it's going to be chronic pain. And chronic pain is almost anything that causes pain. We're not just talking about axial back pain, or orthopedic pain. We're talking about headaches, whether they're tension or cluster or migraines. Osteoporosis, can cause pain. Arthritis can cause pain of any type. cancers cause pain, GI type of thing. So it's a very broad topic in and of itself. And it's nice that the law has always had sort of symptoms because that kind of was a bigger umbrella. Some people didn't realize that if you had Crohn's disease in the first 10 years that you would qualify because nausea and cachexia, is a big umbrella that a lot of things fall under, along with cancer, but they kind of perceived it as cancer. Muscle spasm and spasticity is probably another category because this is going to include a lot of the neurodegenerative diseases like MS, okay? Certainly muscle spasm is part of what we consider chronic pain, but it's a broader category overall. I had a lot of patients who had Friedreich's ataxia, and their family units, and they all kind of come in, and there's a lot of different groups of people that when you certify people over time, you get to realize there's these little cohorts that are interesting. Then there's the whole category of all the gut health and the benefits of nausea and vomiting, that are out there. And whether you have Crohn's disease, or you have IBS, or you have plain old indigestion, or you just eat poorly that everything bothers you, cannabis is going to be a category that you're going to have a lot of benefit. In the mental health area, PTSD became a listed diagnosis in 2013. And there's actually a lot of good data. We'll go over a little bit of that as well. And anxiety and depression is probably another area where people are going to come in. And then there's little button areas like glaucoma and seizures that I see a few people for. Initially, a lot of people would say, oh, by the way, I have glaucoma, and I'm going to use cannabis to help me with that. I just caution a lot of people that sometimes when you have that as part of a secondary diagnosis, I don't think that alone is the best choice for treating glaucoma. And the American Glaucoma Society in 2010 published a pretty good paper reviewing all this. It basically said that it was short-acting, and so it might be hard to really know what you're getting on a regular basis. Most people are very happy to hear that. A lot of people don't want to take medicines. They want to get off their pharmaceuticals. But if you say to them knowledgeably that it may not be the best thing to use alone, then they're very willing to sort of follow along with their ophthalmologist. There's only been one situation where I've actually certified someone for glaucoma that was out of control, and that's because the ophthalmologist called me and said, we've tried all these medicines, nothing's working. Would you see this person? And that was about 8 or 9 years ago. And it did help, but that person was on a lot of medicines. So people don't come in for a lot of that, but it's kind of a secondary issue that they're going to talk about. So I'm kind of moving along through here. We've heard a little bit about the history of cannabis. And I can only say that, it's refreshing that we're at a point where I think it's going to change from a class 1 drug. And the social, political, economic history of cannabis in this country is really embarrassing that we're on the brink of, using cannabis, 100 years ago in medicine, and then it all got suppressed, and there's been a lot of bad press, but that's what happens. But we're kind of at the vanguard here to try to, change things, and I can see that curve is flattening out. We're not struggling as hard to get up, and it's going to happen sooner or later. You do know that it came from Central Asia and the Himalayas. It was used extensively for mystical reasons, but also for treatment 2,000 years ago. It was used a lot about 1,500 years ago for things like respiratory illnesses, catarrh, diarrhea. It was used as a pain medicine back then, and it was actually used, inhalation forms were used, for anesthesia many, many hundreds of years ago. In the 1830s, it kind of became resurrected by the work of Bill O'Shaughnessy, who was a British physician who began to look at the old literature and began to incorporate it again into the practice of medicine in the 1800s. And then we all know how it went downhill from there. The physiology you've heard a bit about so far, and I'm not going to go into it in great detail. But when I use cannabis with my patients, I really prefer a whole plant approach as far as that goes. That comes from my herbal background, my botanical medicine background. I first learned about botanical medicine by working with herbalists, folk healers in the United States. And then as a physician, because I have to talk to groups of educated people who are clinicians, I've learned to add in the science behind it. But in my appreciation of botanical medicine, you've heard things already that when you use a whole plant, there's kind of an entourage effect. But really, plants work because they have a lot of different constituents. And those constituents are not random there. They're actually there in a balanced way to evoke a specific result. There's a lot of plants that have had extracts taken from them and are now used in our modern medical pharmacopoeia. But when you use something in an isolated form, you're more likely, as we've heard, to have side effects from it all. And whether you're talking about how statins came around, they took one of those statins out of 11 and put it in a pill, there's much more benefit when you use the whole extract rather than the individual ones that are there. That certainly happens with cannabis and with other plants itself. I think it's important to note that I often tell people that you probably want a higher CBD and you want a low THC. We've heard about the physiology. I think things work together best when you're using the whole plant extract. Some people have their own preferences. I do not tell patients when they're going to a cannabis store or dispensary which strain I want or that, because I don't know that information. There's too many products. Everyone has their favorite little hybrids and plants and clones, and there's no way that I can do that. But I do know some of the stores and providers around me very well. I've certified a lot of those people who have become cannabis providers in the community. And there's some people that I trust a lot because they seem to be very knowledgeable. And so I often will tell a patient to go to one of these places, tell them what your needs are, what you're looking for, and to really work with them to sort of select the right product. And the least amount that's effective is the right dose. So you start off small and you go up as you need to. A lot of patients come in very knowledgeable already. They just want to be certified sometimes to get access. Other people have no idea where to start. I had a very nice woman in her 80s who had esophageal cancer about 8 or 9 years ago. And she was quite a funny woman, whatever, and it was very sad to see her deteriorating from this. And she was very sweet, and I knew that she was having a hard time because she had metastatic disease in her bones and her appetite was poor. And I called her up one day and I said, Mary, I just want to suggest to you that you may want to consider using cannabis. Did I do something? No, it's okay. And she says, oh, doctor, I'm not one of those type of girls. So anyway, she was in her 80s, whatever. It was kind of foreign to her. But her children were very supportive. And in a couple of weeks, she called me up and she says, I've changed my mind. She says, I'm miserable. And so I had her come in. I certified her. And she went off to the dispensary in Gardner. And she found honey that was infused with cannabis. And she was a tea drinker. And so she started off with a little bit, I don't know, a half a teaspoon, a whole teaspoon, whatever. And she drank it on and off during the day. And she called me up and said, I can't believe how well it's working. Because now she could walk again because her pain was under better control with her walker. And she had an appetite and she was able to eat, given all the problems that she had. So for about 6 months, she really had a wonderful quality of life. She eventually got worse and she passed away. But in those 6 months when she came in, she was just so grateful. And she's just a very simple story of how someone started off, found the right type of form of medicine for themselves, and used it very judiciously. It's very gratifying to see that, because I don't have the cure for the esophageal cancer, but my goal is really to help people feel better. And so when I worked at the Cancer Center in Augusta, I saw a lot of people for the same reasons. I'd often hoped that I had seen them earlier so that they can get through their chemotherapy and treatments, and tolerate it better. But whenever people come in, it was always very nice to start wherever they were and to work with them. So the lowest dose is really the best dose for me. I don't mind if people want to use vaporizers or if they want to smoke or use tinctures or use edibles. I think you have to figure out, what's the most effective way, for you to use it and what's going to work, the best. I had another woman who, she was very funny. She came to me at 90, and I had known her for a long time, and she had terrible orthopedic problems in her legs. And she took a little bit of morphine at night to go to sleep. For some reason, her family thought that she was going to become an addict on the morphine. And they were always struggling with her to tell her not to use it. I mean, they were all pot users, on the other hand, too. So I don't really understand why they were so concerned about a little bit of morphine. But anyway, she had enough of it. She came in one day and she says, okay. And so I certified her, and her daughter brought her over a big Tupperware container of joints. okay? And every night before she went to bed, she smoked, 2 or 3 hits, went to bed, slept really well. Everyone was happy. She slept, the family realized she was not going to become an addict. And in about 2 months, she called her daughter up and said, I need more. And she said, oh my God, you used all that up? I gave you like 60 joints. And she said, yeah, I need more. And so the daughter brought her over more. And the mother brought out the Tupperware container from the refrigerator, and inside were the 60 joints. She used one at a time, put it out, and didn't realize that she could just keep using it. She had like a year's worth of cannabis, her daughter gave her. And so it was very, very funny. So when you work with patients, their stories are very heartwarming, and it's very nice to know that they're doing so much better. So there's a lot of information in here about this, how much the equivalent doses of THC and CBD that they're 20 times the strength of aspirin or twice the strength of hydrocortisone. They're probably not a COX-1 or COX-2 receptor, but they have a lot of basic influences in the physiology, and that they're working on many, many levels. I think it's quite fascinating that cannabis has all these plants that these constituents that you were talking about. But to us in the botanical world, as herbalists, we know all that type of stuff. And so these constituents like D-limonene and linalool, these are constituents that are found in other plants. So D-limonene is found a lot in lemons. Linalool is probably the most active ingredient in lavender. So these constituents are across the board, in the plant world, and we're finding that they have interactions at CB receptors, and they're also adding to the benefit of not only THC causing enhancing sedation or lowering anxiety, but they're actually working on different levels. And that's the beauty of plants, is that there's kind of this adjuvant effect that we sometimes recreate in the pharmaceutical world by adding something to another medicine to maybe enhance its effect. And that happens a lot around pain management as far as that goes. So plants are really quite remarkable. And I think that it's good to appreciate that because it gives you kind of a different sense of how to interact with patients. So let's talk a little bit about some of the studies. So a lot of studies have been done on multiple sclerosis. And initially they showed lots of variable results, and then over time we began to see that there was really more and more indication that it was very good for spasticity. And we do know that there's a lot of improved functions that we can measure in the ADLs, the control of pain and spasticity, urinary control, and improved sleep. There's lots of studies that look at both which receptors are being triggered, and I've given you some references in here. We know that cannabis also has many anti-inflammatory effects, which are part of the cascades of things that happen with multiple sclerosis. And they also affect a lot of other cytokines and chemoreceptors and messengers that are affected in different disease processes. In addition to multiple sclerosis, there's lots of studies going on with Parkinson's disease, with Alzheimer's, other neurodegenerative diseases. And once again, a lot of the results are showing that there's ongoing benefit. There's a study that looked at a placebo-controlled trial that showed a clear-cut improvement in spasticity in patients refractory to other therapies with a good tolerability and a safety profile. So I've seen that pretty much in all the neurodegenerative diseases that I've treated over time. It's very good for neuropathic pain, and so one can use that pretty commonly in those situations. For MS, I think we're pretty clear that it can maybe slow the neurodegenerative process, it can boost the immune system, reduce spasticity and spasm, and improve the urinary incontinence that those people suffer from. Chronic pain. You probably have patients in your practice, whether you certify or not, that have told you that it's helped with chronic pain. A lot of patients come in and see me, and they're already titrating themselves down. They want to get off of their muscle relaxers. They want to get off of their narcotics, their tricyclics, anything that we've been combining over time. And most of the people are finding that it's very, very effective. So we do know that cannabinoids do work well synergistically with opioids, and they act as an opioid-sparing agent as well. So people use less and have a better effect. And that better effect can be not only better pain management, but probably you have to look at ADLs and how they're living their life and being what they're able to do. I have plenty of middle-aged men who've had back problems over the years, have had surgery, compressions, injuries of that nature. And one of the most resounding things that I hear from all of them is that they're able to take part in the family activities. They can take their kids to the park. They can go to a basketball game or the theater and watch their kids on stage perform for more than 20 minutes. They can sit there for 2 hours. And so in many ways, people can tolerate their pain better, but they're also able to function better in many ways. And part of that is I think, cannabis doesn't really have all those sedating effects or those CNS depressant effects that all the medicines are that we're very good at prescribing to our patients. The polypharmacy approach. With good intentions, we're trying to help people, but there's a balance between what is really helping people with their ADLs and their pain, and cannabis is a nice thing to add, to it all. So there are studies that show us that medical cannabis use has been associated with a 64% decrease in opioid use, okay? Decreased number and side effects of medications, and an improved quality of life. I can say from my experience that is pretty hard and fast, my experience with patients. And we know that it works for neuropathic pain, chronic pain, post-operative pain, pain related to diseases like fibromyalgia, cancer pain, and the list goes on, tension headaches, etc. So most of that is pretty consistent as far as that goes. Now with the gut, I can say that cannabis has had a lot of benefits, for patients. There are some studies, they're relatively small, looking at Crohn's disease, and they pretty much reflect the fact that people can decrease their steroid dependency in certain diseases. That's a really nice effect that can happen as far as that goes. I have found that in my experience that most of the time people are coming in for really the nausea and the appetite, stimulation effects that they need. And there's great studies that show cannabinoids are more effective than placebos, compared to antiemetics like chlorperazine and donsitron. And that's been my experience as well. A lot of the cancer patients are given a whole battery of anti-nausea medicines. They still come in to look for cannabis certifications, and by and large, they often feel that cannabis works far better for them than anything else that they've been given. And they're pretty sick people, and they've lost a lot of weight, and they've gone through a very difficult time. And this medicine seems to work pretty well. There's good studies that are meta-analyses that have reviewed the antiemetic effects of cannabinoids in cancer patients during chemotherapy, and they've shown that they're superior in a meta-analysis over the other medicines that are used. Over the years, there have been patients. I have not seen many patients with Alzheimer's, dementia, but I think that would probably be very beneficial in many ways. Maybe the anti-inflammatory effects are going to slow things down. The sedative effects might be very effective, for people with agitation, as far as that goes. We talked about glaucoma, a little bit as well. There's not a whole lot of studies with Alzheimer's, but I think that, there the efficacy, is yet to be, talked about. A little bit about side effects. I've seen very little side effects where people would have to stop their medicine. If I kind of live by the rule of, high CBD and low THC, people tolerate it pretty well. There are people, though, who seem to be very, very sensitive to the THC, and if you uncover, paranoia or dreams that they can't control, you may have a small amount of patients who are not going to tolerate it very well. But that's kind of where a dispensary and the cannabis providers out there might be able to help that patient a little bit more. I don't have that specific knowledge to know which strain that they should take, because there's so many variabilities. It's the strain, it's the entourage effect, it's the consistency in the medicines that they're taking. We don't always know how consistent the concentrations are that are out there. But I don't find a whole lot of severe side effects that are out there. People certainly have dry mouth. They might get some tachycardia. They may have some blood pressure effects, but for the most part, that doesn't seem to happen a whole lot. I think people have to realize what dose they can tolerate so that they do not lose motor coordination or reflexes and things of that nature. People seem to be able to drive, using cannabis, but you have to be a judge of your own, skill level, at that point. There are studies that are all over the board that show that there's little effect, to some effect, but most people understand that they have to be very, cautious. For people who have used cannabis their entire life, for 30 or 40 years, and are just coming in to be certified, they're kind of well aware of that. And everyone else who's naive to it all, they're very, very cautious, about coming in and using anything. So that's why I always start with the lowest dose, possible. Certainly inhalation products might cause some respiratory issues like laryngitis or bronchitis or some irritations. On the other hand, they should be very helpful to sort of alleviate, some of that, and certainly with asthma, it should, be of benefit. Though it's a double-edged sword, you have to be careful about what triggers your asthma and whether it can be, used like that. I put in here a slide about, other herbs that might have a sedating effect. I'm not really concerned about most of them as far as that goes. But people who are using additive herbs because they're into the natural way to treat things should just be very aware of that type of stuff. I can tell you that us as physicians are really good at polypharmacy, as I've mentioned already, and we create many more side effects than I think the combination of most of the plants that we're going to use in those situations. There's a couple of things to know about drug interactions. Probably the most significant are with barbiturates and theophylline, that it can lower the blood levels of those. Those are not used very much anymore, so I don't think it's a big concern, but just FYI, be aware if that's the case. We've talked about CNS depression. There have been a couple of cases of hypomania with a combination of disulfiram and fluoxetine. And you can affect the INR levels for people who are on Coumadin, but you have to use an awful lot. So it's a moot topic, but it's there so that you know. Now, comorbidities, in the mental health world, I think is a very interesting area. I think the studies on PTSD have been very, very supportive of cannabis use. I've certainly seen it in patients, who come in now more often asking for PTSD. They're usually using it already, but they're actually, benefiting quite a bit. There are actually studies that show that when people have new traumatic events because they have PTSD, it actually doesn't cement the new traumatic events in their lives to contribute to the PTSD. It actually attenuates it. So that's a very fascinating aspect, I think, of cannabis in the treatment of PTSD, which is very, very common, in our clinical populations. It's certainly good for social phobias and anxiety. I've seen people use that a lot. I think the studies on depression are kind of all over the place. But quite honestly, anxiety and depression are kind of in a continuum of symptoms. So some people are more anxious than they are depressed. So you have to use your clinical judgment, I think when it comes to certifying patients for medical use, if you're doing it for your own patients, then you know them very well, and you can probably have a more knowledgeable way to help them understand, what is going to be beneficial to them. When I do consults, and that's the majority of my cannabis patients, I have to rely on the medical records, that I get, and then have a pretty, good conversation to be sure that it's the right medicine for them. But by and large, people have, benefit from it a lot. I have had some patients who have used it who have schizophrenia. I have not seen that it has made things worse. I have not seen new psychoses in young adults who have used it, but the literature will tell you that you have to be pretty careful about that. I do find that patients with bipolar disorder are probably your most challenging group of people who want to use cannabis, because they're a group of people who, just by the nature of their mental illness, they like to get off their medicines, and they get to the point where they don't want to take them, and they think they're fine, and it's time to stop it all. And they, each and every time when they do that, will come in and they say, "Doctor, I can't get enough cannabis. I don't know what's wrong, but something's not right." And they're really using a lot of cannabis at that point. And I've learned, just through experience, to say, are you taking your medicines, or what's changed? And they, opened up and shared with me, well, I stopped my medicines and I feel really good, but this cannabis, seems not to be working for whatever reason. And I've just learned to check in with that group of patients all the time. Are you taking your medicines? And if they're acting like that, then I'm very suspicious that, they've changed, their protocol. So I encourage them to be, very diligent with their medicines and to talk to people before they just decide to stop them. There's cannabis, abuse syndrome, and I think, do I see that a lot? Have I identified it? Probably not. But if people have to depend on cannabis to do everything, or if they're avoiding all their activities in life and they're really secluding themselves, not going to work, not going to school, not taking care of their family needs and things like that, then like with any abuse situation, we have to be careful that they might be overusing for whatever their needs are. And generally, they're enjoying it, and it's not really a medical use, at that point. We all know that there's some synthetic, cannabinoids out there like K2 and spice. They're not legal in Maine, but anyone can carry them in here, so be very, very thoughtful about that. As an integrative doctor, when I do consults, I spend an hour with my patients, and that's kind of the way that I practice. I know getting a certification is much easier these days in various ways. I'm just concerned that the way that I practice, that I'm going to be true to how I want to help my patients. And I would encourage all of you that if you know your patients, that's wonderful. It's much easier. If you can learn other integrative skills, you can use plant medicine. You can certainly know about nutrition, and I think that's really important. Lifestyle management, breathing techniques. There's all sorts of things that you can do very quickly in a 15-minute, appointment. I can teach a breathing, technique to all my patients in about a minute and a half, and then we can practice it for another 30 seconds, and that takes 2 minutes out of my day. I prioritize that I like to talk about nutrition. If you want to talk about pain and gut health, you have to talk about nutrition, okay? Get savvy and learn about Mediterranean diets, know what an anti-inflammatory diet is, use a paleo diet. Try to get people on whole foods, as much as you can, and make small changes consistently. People will do far better. Cannabis is not the answer for everyone's problem. There's a lot of people who come in and want that, but when I see them, they have the opportunity, whether they're expecting it or not, that I'm going to talk their head off about a bunch of other things, and I'm going to give them handouts about whatever herbs I want them to have, and whatever nutritional things, or whatever I can do in that period of time. And then they can come back as often as they like, if they're just seeing me as a consultant, because I'll work with them if they want to have multiple sessions to do things. And just to highlight this point, I can tell you that I had a patient about 8 or 9 years ago who was in his late 50s and had rheumatoid arthritis. He walked in, I don't know how he got to my office, because he lived in Shin Pond, which is on the other side of Mount Katahdin, but he found his way to my office. And he walked in, and he was, had a lot of deformities from his rheumatoid arthritis, and he used 2 canes to balance himself. And he said, "Doctor, my problem is that I can't balance myself and swing an axe to prepare my firewood for the winter, and I'm really worried. What am I going to do?" And so he was on Plaquenil. He was on all sorts of doses of steroids for well over a decade, almost 20 years. He used a little bit of hydrocodone, which he said he didn't really think worked very, very well for him. And he used cannabis more often. And he wanted to be certified. So he came in and found me. He had his products and everything that were there. And he was growing it himself, and he smoked. And I said, that's perfectly fine. I also gave him turmeric. So if you want to learn one herb that's an anti-inflammatory and does a whole bunch of other things because it's an herb, use turmeric. Very, very safe. Doesn't have all the NSAID type of side effects. And it also detoxifies your liver, so when you're taking all these other medicines and chemotherapies, it works really well. It also has a lot of oncogenic gene effects too, so you're actually hitting things on many, many levels that are there. Gave him that, and I give everyone vitamin D. Everyone's vitamin D, unless you're taking it, is low. I take vitamin D. And then, at the end, we talked about his diet. And so what he told me is he drank 2 to 3 pots of coffee a day. That was it. And he ate cheeseburgers, and he ate pizza. And so whenever I hear things like this, I always say, well, do you eat vegetables? Oh, doctor, if it's on the pizza, I'm eating the vegetable. Okay. And I make, I talk about water. Oh, doctor, I make my coffee with water, but he never had a glass of water. And I said to him, do you realize that what you eat affects your pain? And he said, what? I can feel better if I ate differently? He says, my wife has a vegetable garden. She eats her food, and I eat mine. So I gave him a few suggestions. I said, kind of joking, I said, why don't you just drink 2 cups of water and 2 cups of coffee and 2 pots of water, every day. And you'll probably notice in about a week, something's getting better. And then we talked about a Mediterranean style diet, and I gave him basically, some handouts on that. And we just talked about whole foods and, the pro-inflammatory effects, of certain types of food. He came back in 4 months, and it was amazing. He walked in with one cane that he was using because he wasn't in his own house anymore, so he needed it. He didn't need it anymore. He lost about 8 or 10 pounds of weight. He looked differently. He had reduced his steroid dose from 20 to 5 milligrams of prednisone. And he said to me, "Doctor, I've never been able to tolerate 5 milligrams." He says, "When I get to this point, I always have to go up to 20. I've never felt this good in over a decade." And I said, "Wow, that's really great." He says, "Why did no one ever tell me what you told me about how to eat differently?" I said, "Well, that's another issue. I haven't been able to fix that problem." But we're making slow steps in teaching at least family doctors how to talk about nutrition. And so in his case, he needed some cannabis. It had minimal side effects for him, but he changed his lifestyle a little bit. And he's the unusual one. He got up and he left. He did everything I said. That's a small percentage of our patients. But he came in not expecting everything that he was going to hear, and he took it all to heart. Most patients change a little bit slowly than that. But the fact is, as primary care doctors, or whatever role we play in people's health care, we can support them and walk along with them and help them make slow, steady changes to a better outcome. So cannabis, has many, many benefits, but I think a holistic approach, in my experience, has made what cannabis can do for people even more powerful by helping them understand how they can help themselves and offer them other techniques for healing. So that's my story about cannabis.